Introduction. Equine herpes virus type 1, EHV1, is a common viral infection in horses worldwide. It is known for causing respiratory disease, abortion, and neurological disorders, including equine herpes virus myeloencephalopathy. This neurological form is particularly severe, often following respiratory infection and viremia. The virus inflicts damage through mechanisms such as inflammation, vasculitis, thrombosis, and ischemia, which collectively contribute to significant neurological impairment. Young performance horses are notably susceptible to which can reactivate during periods of stress, leading to outbreaks with considerable health and economic impacts. The latent infection rates in horse populations are high, estimated between 54% and 88%, making the management and prevention of a persistent challenge in equine medicine. During outbreaks, around 10% of horses develop neurological signs, which can range from mild ataxia to severe recumbency. Three main genotypes of EHV1 have been identified: non-neuropathogenic, N752, neuropathogenic, D752, and a new variant, H752. Horses exhibiting severe neurological signs, such as recumbency or those needing sling support, generally have a poor prognosis. Recent years have seen an increase in outbreaks in regions such as France, the Netherlands, and the United States. Sport horses, particularly those involved in competitive events, are at elevated risk of EHV1 outbreaks due to factors like frequent travel, the stress of transport, and being housed in temporary facilities with suboptimal ventilation. Although there has been extensive research on the risk factors for developing and its severity, there is limited information about the long-term outcomes for show-jumping horses following an outbreak. This study aims to bridge that gap by investigating the relationship between the severity of and the likelihood of horses returning to their previous performance levels, as well as examining the impact of clinical variables on their long-term prognosis, materials and methods. Patient data and outbreak description. This study examined data from 26 horses admitted to a veterinary teaching hospital, VTH, during an outbreak at an international jumping event in Valencia, Spain, in February 2021. The outbreak began with one horse showing pyrexia and mild ataxia, which stabilized and was discharged within 6 days. As the outbreak progressed, more horses exhibited symptoms such as pyrexia and ataxia, leading to the event's cancellation and the referral of severely affected horses to the VTH. Admission and clinical management. Of the 25 horses referred to the VTH, most were European breeds, including 16 females and 9 geldings, averaging 9.7 years old. Admission priority was given to horses with ataxia grade 3/5, altered mental status, or urinary complications. Detailed histories, including vaccination status and clinical signs, were recorded for each horse upon admission. Diagnosis and treatment. Upon admission, each horse underwent blood tests, and nasopharyngeal swabs were collected for PCR testing to confirm EHV1 infection. Despite the PCR results, all horses from the outbreak were treated as positive cases due to the high risk of contagion. Treatment protocols included thorough physical examinations, neurological assessments, and tailored medical interventions based on disease progression. Severe cases of ataxia received sling support, and euthanasia was considered for horses with unresponsive severe neurological or systemic complications. Physical therapy and follow-up. Recovered horses participated in a structured rehabilitation program that included proprioception exercises, core work, and neuromuscular stimulation to aid recovery. A follow-up survey was conducted with owners or riders 2 years post-admission to evaluate the horse's performance levels. Performance data were also collected from the Fédération Équestre Internationale (FEI) website. Horses were scored based on their ability to return to their pre-outbreak performance levels. Results. Return to exercise and performance levels. Out of the horses affected by 68% returned to some level of exercise, with 52.9% achieving their pre-outbreak performance levels. Horses presenting with ataxia grade 4/5 at admission had a higher fatality rate and only a 10% chance of returning to their previous performance levels. None of the horses experiencing both vascular and urinary complications returned to their pre-outbreak performance levels. Vaccinated horses and those with urinary complications had fatality rates of 71.4% and 43.7%, respectively. Detailed case analysis, clinical course and complications. The clinical course of varied significantly among the horses. Some exhibited rapid neurological deterioration, requiring intensive care, while others had a more gradual onset of symptoms. The presence of complications such as recumbency, altered mental status, and urinary incontinence significantly impacted the prognosis. For instance, horses that developed severe ataxia often required sling support to remain standing and had extensive rehabilitation needs. Treatment approaches. The treatment regimen for was multifaceted, focusing on both symptom management and supportive care. Anti-inflammatory medications, antiviral drugs, and supportive therapies such as IV fluids and nutritional support were commonly administered. Horses with severe neurological symptoms benefited from intensive physiotherapy, including exercises to improve balance and coordination. Long-term recovery and rehabilitation. Long-term recovery was closely monitored through regular follow-up appointments and communication with the owners. Rehabilitation programs were tailored to each horse's specific needs, emphasizing gradual reintroduction to exercise and ongoing physiotherapy to restore neuromuscular function. Horses that successfully returned to their previous performance levels often had a comprehensive rehabilitation plan and consistent follow-up care. Discussion. Poses significant challenges to the long-term performance of sport horses. The severity of neurological symptoms at admission is a strong predictor of the outcome, with horses showing severe ataxia or systemic complications having lower chances of returning to their pre-outbreak performance levels. This underscores the importance of early intervention and comprehensive management during outbreaks, vaccination and immunity. While prior vaccination against EHV1 is crucial for disease prevention, this study found an association between vaccination and higher fatality rates during the outbreak. This could be attributed to pre-existing immune responses that exacerbated the clinical course of Further research is needed to understand the role of vaccination in the pathogenesis of and to develop strategies that balance disease prevention with minimizing adverse outcomes. Conclusion: equine herpes virus myeloencephalopathy significantly affects the long-term performance and health of sport horses. Horses with severe ataxia or systemic complications at admission are less likely to return to their previous performance levels. Early intervention, comprehensive management, and tailored rehabilitation programs are essential for improving the long-term prognosis of affected horses. Understanding the clinical variables that influence outcomes can help veterinarians and horse owners make informed decisions during outbreaks, ultimately enhancing the well-being and performance of affected horses.